Hello, my name is Mansoor Shafqat. I'm the Director of Performance Improvement here at the Brownville Memorial Hospital, and I'd like to welcome you to the training workshop on health literacy. I'd like to start off by giving you a working definition of what health literacy means to me. Health literacy is the ability of an individual to comprehend their health information from various sources such as providers, medical handouts, health log, and then be able to execute any action required accordingly for their medical health, such as taking a prescription medication according to the direction of their medical provider. So how do we as healthcare professionals help our patients help achieve good health literacy? We're going to be looking at two key areas of concern during this workshop, and following the exercise, which we'll get into in a little bit later, participants here will be able to use open-ended questions to encourage patient questions and then use the teach-back technique to check for understanding. The two key areas of concern we're going to be talking about is communicating clearly with the patients and then encouraging patients to ask questions. Consider the following example. A first-time mother brings her 6-month-old baby daughter in for a visit to the pediatrician. The doctor makes the diagnosis of an ear infection and prescribes antibiotic and tells the mother to pick it up from the local pharmacy. The mother picks up the medication, gets to her home, fills up the medication in a teaspoon, and pours it into her baby daughter's painful ear, which was supposed to be given to her orally through the mouth. Well, what happened here? Breakdown of communication, right? It is highly critical for healthcare providers and their team to communicate clearly with the patients and take their time explaining them how and when to use medications or perform other medical tasks. It is important to realize that nearly 90 million Americans have difficulty understanding health information, and since this is true, how do we as healthcare providers help in disease prevention and detection? This is where communication clearly is so important. Let's shift gear a bit from individual health literacy challenges to the health literacy environment. It is a fact that the patients now have less face-to-face time with their providers during the brief office visits and short hospitalization. When looking at the health system in general of our country, it is complex. From the health insurance industry to navigating on how to get an appointment with a specialist through the proper referral channels, it is a complex system, no doubt. Did you know when the providers ask their patient, "Do you have any questions?" and the patient shakes his or her head indicating no, it does not necessarily mean the provider did a good job communicating with the patient, but it could simply mean the patient is trying to be polite and just trying to avoid any confusion because they're already so confused and just shakes their head saying no. So according to Dr. Carolyn Clancy of Agency for Healthcare Research and Quality, involved patients tend to have better, healthier outcomes. Ask questions in ways that encourage a response, like, "What are your questions?" This is an open-ended question. It signals the patient that the questions are expected as opposed to closed-ended yes-no type of questions. Provide a pen and paper in the waiting area as well as in the exam room for patients to write down their questions. Let's now look at the key communication principles. The Office of Disease Prevention and Health Promotion laid out the National Action Plan to improve health literacy. The National Action Plan to improve health literacy is based on two core principles. All people have the right to health information that helps them make informed decisions. Health services should be delivered in ways that are easy to understand and that improve health, longevity, and quality of life. The action plan consists of 7 goals that will improve health literacy and strategies for achieving them. Number 1, develop and disseminate health and safety information that is accurate, accessible, and actionable. Promote changes in the healthcare system that improve health information, communication, informed decision making, and access to health services. Incorporate accurate, standard-based, developmental, appropriate health and science formation in childcare and education through the university level, support and expand local efforts to provide adult education, build partnership, develop guidance, and change policies, increase basic research and development, implementation, and evaluation, and then finally, increase the dissemination and use of evidence-based health literacy practices and interventions. Remember, both the providers and patients need to listen closely. They need to be able to respond thoughtfully and remember clearly what each other just said. It is not just the job of the patient. Treat it as a partnership. What are some of the key communication principles we as medical providers follow to help our patients achieve their health outcomes? Appreciate why communication can be hard for patients. It is a fact that many patients find it difficult to participate in health conversations. They may fear that their medical team won't like them if they ask too many questions. They may feel ashamed to admit not understanding medical terms or health-related tasks, such as how to use an EpiPen. We need to help our patients ask questions. You can encourage patients to ask questions by providing tools like notepads, which allows them to write down their questions about diagnosis, treatment plans, and any other medical instructions. Acknowledge articles and printouts that the patients bring to you. If a patient brings material from home that they research on their own or saw on television, let them know that you value their effort and are open to their suggestions and questions. Confirm that you and your patient understand each other. After communicating key points, pause periodically. Ask patients to tell you in their own words what you just discovered. You can start by saying, "I just want to make sure I explained this clearly. Please tell me how you'll go about taking this medication." Provide patients with resources to learn more. This can include handouts, articles, website, different hotlines, and one can even point their patients to blogs that are devoted to patient gaining additional information on their diagnosis and treatment. Looking at best practices that are recommended, although health professionals spend many years learning the various medical terminology and concepts, it is important that they use simple language when communicating with their patients. Patients may be unfamiliar with the various medical vocabulary and can get confused easily if they cannot follow what their doctor is referring to. Medical jargons refer to technical terms and phrases or words used in special ways. While these terms may be familiar to you or your colleagues, they might be totally foreign to your patient and their families. Do not use abbreviation or acronyms which refer to shortened ways of referring to long, more complicated terms. Once again, these might be easy to use in medical charts, but if a patient was to later look at their medical record, they might not be able to understand these notes from their doctor. For example, in eye care, the abbreviation OD stands for Oculus Dexter and is commonly used on prescriptions, which simply means the right eye. So instead of using OD, write out right eye. Avoid using homonyms, which are words that sound alike and may or may not be spelled in the same way. Avoid using idioms, which are phrases that mean something totally different from their actual words. There are times when even commonly used words like may, might, and suggest are difficult to understand. This happens often when describing risks. For example, the statement, "this treatment might help," can easily be translated by your patient as this treatment will help. So to patient, that might be desperate for getting some sort of help for their medical condition. So avoid using simple words that are not so simple. Recommended best practices, there is a remembering of the golden rule. The golden rule says, "Do unto others as you would want them to do unto you." Best practices when dealing with your patients to improve communication include: when entering the room of patients, always tell them you're there to help comfort them and to do your best to relieve their pain or symptoms. Remain calm, show empathy, express concerns for the patient's feeling. Use the I statement. Example, "I would really like you to take this medication," versus "you really need to take this medication." Helpful strategies when dealing with patients with language barriers. Work with interpreters and translators. speak at a slower pace. Use common words. Example, kidney doctor and not nephrologist. Or another example might be blood pressure and not BP. Remember, whether patients are born and brought up in the United States or somewhere else in the world, they bring their own experiences, values, custom. For example, those from the developing countries where medical care is scarce may not understand why screening tests such as mammograms are required. So it is our job as medical care providers to use plain language and common words to help them understand the importance of such exams and routine checks. The small group exercise that we're going to get into doing here is doing the teach back technique. Since I have 40 of you here today, we'll get into pairs of 2 and have 20 pairs total. One of you will play the health professional role, the other will play the patient role. So in interacting with your patients, use the teach back technique, which is also known as the interactive communication loop. After informing the patient of a task related to their health, ask them to explain it back to you using open-ended question. For example, I know this is a lot of information, so be sure I've explained it correctly. Can you tell me how you're going to take care of your incision when you're at home? The purpose of this technique is to assess and confirm patient's understanding. The materials and actions required. Basically a pen or pencil, writing pad, which are here provided to you, paying close attention to your patient's body language, listen for key concepts and note down if it was left out, invite patients to be partners, setting a tone of partnership, take home written instruction on paper. The steps for the teach back exercise today is going to be, first, one of the person here is going to be a healthcare professional, so be sure to communicate clearly with the patient regarding the procedure, diagnosis, and the second person is going to be the patient. And then upon completing the explanation of diagnosis or method to be utilized, ask your patient an open-ended question. Example, now that we have talked about how to lower your cholesterol level, what types of food will you try to avoid eating? And then the patient is going to respond. The time frame required for this interactive communication loop exercise is variable depending on the patient's clear comprehension. If you notice that your patient omits any key concepts that you went over earlier, just restate the new health concept, tailor the message to make it more easier for them to understand. Example, instead of saying eat healthier diet, you could say, if you previously only had 1 serving of vegetable a day, let's try to increase it to 3 times a day. The anticipated results or outcomes that you'll get out of this exercise is the teach back method will get your patients involved. Patients will ask questions on concepts that they aren't clear about. And as patients ask questions, offer reassurance to make patients feel more at ease, which will encourage further patient involvement. At the end of this exercise, there's going to be some surveys that are going to be provided to you in the back of the room. Please fill out the multiple choice surveys to let us know what you thought about the exercise. Feel free to add any comments or how the exercise can be improved for future small group exercises. My staff and I will be reading these to make further improvements to the group exercises. And I thank you for your time and thank you for attending.